I'm Dr. Lalitha Reddy. I'm the founder and director for Wholesome MedTech Private Limited, which has the brands for men and for kids as of now. Men's health has always been traditionally ignored globally as well as in India, but then there is more amount of awareness and it has picked up over the past few years abroad, and we can see the change in India too, probably because of the millennial mindset and more sickness and people willing to talk about their issues, and the willingness to get better and improve their quality of lives has probably added to this growth in the men's health and wellness market. So over the last 2 to 3 years, there's been a significant growth of around 16 to 17% CAGR in the men's health and wellness industry in India. There's been a significant change from the pre-pandemic to the pandemic era. Initially, probably pre-pandemic, there was not much keen interest or awareness in a person's personal health or wellness part of it. But then once the pandemic hit us and we were taken by surprise, and then we figured out that we do not have medicines or we did not have a vaccination at that point of time, the focus of everyone, starting from the healthcare industry as well as an individual, was more onto how do I prevent myself from getting this, or how do I heal faster. And with so much of information about how to keep ourselves healthy, how to avoid infections and how to recover faster, with so much of information being given from various sources, now everybody is aware and more conscious about their health and their wellness. Now previously, who knew about what zinc was? Who knew about whether vitamin C or vitamin D would help us recover faster? Now if you ask anyone, now they are so aware of things like immune boosting foods and how do we keep ourselves more healthy, and how does a bit of activity help us, why it is important to sleep better, sleep helps in immunity and such things. Now the word immunity has gained so much of importance that worldwide the industry for the growth rate for all these immune boosting foods has grown by 40% over the last 1.5 to 2 years. So in a way we could say that COVID has helped us become more conscious and more aware of our health and wellness, and has made each and every person realize that preventive health is much more important than curative health. It is very important to develop healthy lifestyles, healthy habits, and remain healthy. So in 2020, I was associated with hospitals. I was heading a 1,000-bedded hospital, Yashoda Hospitals, which is a corporate hospital chain in Telangana. So when we had this COVID initially, we could see the amount of panic that people were facing. Even when they had minor symptoms, they used to rush to the hospitals. We used to run out of beds. There was not enough nursing and paramedical staff, and even the testing kits for COVID were not available at that point of time. With the lockdowns, it was so difficult with the logistics to get the PPE kits. So when we saw all this panic in the people, that got me and a group of doctors thinking, this group who were always interested in preventive health as compared to curative health, you can always prevent it. So with this in mind, and with the experience of the past 25 to 30 years that we've had in the healthcare industry, all of us thought, why not we get together and do something that works more towards preventive health and educates people and gives answers to raise their quality of life, their immunity status, and something which would help them from falling sick. So we wanted to focus more on men's wellness and kids' wellness for a few reasons. See, now with this team of doctors and experts and pharma experts that we had collectively, we were a team from all across the country. So we had experience of more than lakhs of patients over so many years. So what we had gained and what we had seen was that there is a certain inhibition for men to talk about their issues. See, when a problem is significant enough, anyway you will come to a hospital and meet a doctor. But then for simple issues which ruin your quality of life, which give you unhappiness, which also reflect negatively on your family, like say for instance sleep issues. I can't imagine a man just going and telling a doctor, okay, I'm not able to sleep well, do something about it, or I'm having performance issues on and off right now, I'm not able to father a child, or I keep falling sick. So these issues, which they were not very open to talk about and which could be easily dealt with and which reflected negatively on the rest of the family, which affected their quality of life also very negatively, leading to unhappiness which they refused to talk about, we wanted to address this hidden problem. And coming to children, well, as a mother myself, we do our best to give whatever best we can to our children. But then in the present day scenario, with both the parents working and even the quality of stuff that we can get and give our children, and the nuclear families, less family support, we're just not able to do enough as far as the nutrition is concerned. Even children of the wealthy families are developing vitamin deficiencies. So a lot of inputs were given by pediatricians from across the country. They said parents brought their children saying the child is so restless, the child is not able to concentrate. You work the child up, he has a magnesium deficiency. Now this was a child from an affluent family who has enough money to eat, but then the child has a magnesium deficiency. Or there is a stunted growth. My child keeps saying that he has pains, or he keeps falling frequently, he keeps hurting frequently. He doesn't, his growth is not as per the growth chart. Then you look at the child has a vitamin D deficiency. The child is always indoors, the child is sleepless, the child is restless. Why the child is not getting enough sleep? Why? If you dig into the history, too much of exposure to the screens, too much of blue light. So we saw a lot of issues of wellness and lack of awareness amongst the parents also, which was affecting the health of our future generation. So we wanted to create a platform which parents could trust, a platform by doctors who would give expert advice, which a parent can trust blindly without having to do their homework. We did have quite a few challenges. See, we had the medical knowledge, we had the expertise, we knew what formulation would work. Now, one of the first challenges when we went out, when we formulated a product and then we wanted someone to manufacture it. Now, most of these manufacturing facilities had their own fixed formulations which were made by we don't know by whom, and then the quality of the ingredients that they used were also quite bad. Just to give you an example, we wanted to make a magnesium plus zinc plus vitamin effervescent tablets, and then all the manufacturers wanted to give us only magnesium oxide. Now, as doctors, as pharma experts also, we know that magnesium oxide is only 4% absorbed in the body. So if I give them 100 milligrams of magnesium, 4 milligrams would go into their body. Unnecessary, it is a waste, and then it added to the metallic taste. So we had to look around for those manufacturers, those ingredient providers and those partners who were as conscious of quality and purity as we were. I had to find someone who was willing to give me the bisglycinate salt of magnesium, or who wanted to give me the picolinate salt of zinc. So these kind of quality guys were a little difficult to find, but then we did our research and finally we were able to partner everybody, whether it is branding, whether it is packaging, whether it is sourcing of ingredients, it was a manufacturing facility, whether they had all the certifications that we wanted, and they were willing to do it in the dosages that we wanted. We had so many products, we had analyzed a lot of products, and then we saw that they said it was a multivitamin gummy, there were only 4 vitamins in very poor dosages. See, we follow the ICMR chart that is given for the Indians. The requirement for Indians is different as compared to requirements of Americans. So we have the online platform. For men it is formen.health, and for children it is getforkids.com. So you can log on to the website, and then we have all the products on display, and then we have a blog section too, which is very important and which is being very well appreciated. Here we give information and educate people about the issues that they are facing and about the products as well as each and every ingredient. So once you want a product, once you click on that, the entire information about the product is given, like what dollar does it contain, what are the exact proportions of the ingredients, and what does each ingredient do, and about the dosages, and if at all, if there are any side effects, what are the possible side effects, and what are the precautions that you have to take, the ideal time to consume the products. So now in the future we plan to expand on the products as well as the categories. Now our main focus will be to solve the issues that are being faced by people as far as their health and wellness is concerned. So we will go that way. It will be more health and wellness conscious rather than more of on the cosmetic side, because our primary motive is to improve the health of people, and then like I said, our focus is always on preventive health and improving the quality of life of Indians. So not only would be doing this product expansion and the category expansion, but we will also like to explore the international markets too very soon.